Hello, families. Welcome to our presentation about the services and programs that help keep your student healthy and well while at UNC Chapel Hill. My name is Sarah Stallman, and I am the Communications and Special Projects Coordinator for Health and Wellbeing within UNC Student Affairs. This presentation is going to focus on one initiative and three service providers. We'll start by talking about the Heals Care Network and then move into student wellness, which leads health promotion and public health efforts, counseling and psychological services, fondly known as CAPS, which is the mental health provider on campus, and campus health, which is the primary medical provider for students. So the Heals Care Network is a campus-wide strategy to create a culture of care and compassion at Carolina. The intention of the Heals Care Network is that every person on campus can support another person who might be struggling. To help with that, care.unc.edu showcases mental health trainings offered on campus, as well as the many mental health resources available to campus community members. This includes campus agencies, such as those we'll discuss today, student organizations, government resources, and vetted nonprofits. The site can be helpful for anyone connected with UNC Chapel Hill, including families. The Heals Care Network offers a filterable resource hub, showcasing over 100 mental health resources that can support people in the UNC community and can be filtered by urgency, cost, identity, type of service offered, mental health need, and campus affiliation. Specifically for families, there's information about what to do if you're concerned about a student, including strategies to have a conversation. In most cases that don't involve imminent harm to self or others, a conversation with the student may be the best strategy. Many people in distress believe their struggle is invisible. Having a caring person notice and offer support can be a step towards healing. If the issues are beyond your ability to help, you may want to call and talk with someone at the Dean of Students or CAPS about how you can best support the student. You can also submit a care referral form to let the university know that you've tried helping the student on your own and still require assistance. In addition, I'd like to draw your attention to the peer chat in the bottom right of this screen capture on the slide. This is a live chat feature staffed by student peer listeners who can support students, families, faculty members, anyone who uses the website to help them navigate the many resources and better understand how to offer support. Switching gears a bit, the student health fee is a mandatory fee that all degree-seeking students pay through fees and tuition each term. The charge will appear on your student's university account as fee student health, and it will be $205 per semester. The reason we're talking about it now is that it gives students access to all of the services that we're about to discuss. It covers visits to primary care, same-day or urgent care, and gynecology. So that means your student can visit and speak with a provider in any of those areas without any copay or out-of-pocket charges. The health fee also funds support for students who require off-campus referrals, academic protocols related to health, such as medical withdrawals, sexual violence prevention and response, as well as public health efforts focused on Carolina students. Details about what is and isn't covered as part of the health fee is available on the Campus Health website. We'll spend the most time today talking about these three health and well-being services, all of which are funded by the student health fee. And they're located at various spots across campus. Student Stores Pharmacy is, perhaps not surprisingly, located in student stores. Student wellness, you'll see at the bottom of the screen, is in the Student Affairs Services Building South and is located on South Campus. And then the primary health services building on campus houses Campus Health and CAPS. It's located near the south entrance of Keenan Football Stadium beside Gate 6. So basically it's between Keenan Stadium and UNC hospitals. You should know, however, that neither Campus Health nor CAPS are affiliated with UNC hospitals. From a transportation perspective, the Campus Health building has a limited number of parking spaces for folks receiving care at Campus Health or CAPS. In addition, UNC offers a free shuttle service called Point to Point, which is available 24 hours a day and 7 days a week, and can help students get from wherever they're located to our building. We understand that a student's health and their ability to thrive academically are closely linked. Student wellness assesses and develops strategies to address priority health issues. They do this using multi-level evidence-based prevention strategies, such as peer education, social marketing, social norm campaigns, environmental changes, and strategic campus partnerships. Assessment and evaluation are at the core of student wellness work. They ground initiatives and programs in research and evaluation that ensure their efforts are needed, relevant, and effective. In addition to their ongoing assessment of various initiatives, they administer the National College Health Assessment and the Core Alcohol and Drug Survey at regular intervals to inform their health promotion efforts. Student wellness uses 8 dimensions of wellness to help define the complexity of wellness and support students in staying well. They view wellness as being able to create and have harmony with all of these dimensions. Student wellness offers wellness workshops, one-on-one appointments like wellness coaching and sexual wellness sessions, large-scale events such as the Wellness Carnival and last day of class wellness programming. They offer safer sex supplies, health-related student groups, and recovery communities. Counseling and Psychological Service is located on the 3rd floor of Campus Health. We know that student mental health is critical for success, and we want you to know the services that are provided around mental health and how your student can access them. CAPS focuses on meeting the immediate mental health care needs of students. What that means is that if a student is in need of mental health support at 3 a.m., they can access it by calling the CAPS phone number and reaching a trained clinician. Or if a student needs immediate support during weekday hours, they can come into Campus Health at their convenience and speak to a therapist that same day. The office is open Monday through Friday year-round and offers initial non-crisis visits between 9 a.m. and noon or 1 p.m. and 4 p.m. Students who are in crisis are welcome to come in anytime the office is open, and once again, can call that phone number 24/7. For anyone accessing CAPS, there is no need to schedule that initial visit. The student can arrive when works for them and be seen that same day. During that initial visit, the student will complete paperwork, meet with a therapist, and leave with an individual plan for next steps that will address their concern. Next steps could include any of the following services. CAPS offers brief therapy, that is, therapy that can be completed within a brief time frame. Brief psychotherapy through CAPS or UWIL has no session limits. Brief therapy is appropriate for concerns that are emergent and have not had treatment in the past. UWIL is a digital mental health provider which allows those students who don't have availability during CAPS regular hours to access brief treatment providers online. 70% of students who connect with psychotherapy after an initial visit with CAPS are served on campus through brief therapy, group therapy, or medication management. Ongoing therapy would be for those issues that have had treatment in the past or for students who want continual contact with a therapist throughout their time at UNC. For those types of needs, referrals are made into the community, and referral coordination helps students connect with a provider, taking into account that students' preferences and needs such as insurance, location, identity, specialty area, and things like that. CAPS supports embedded counselors in various academic departments around campus. Currently, embedded counselors are offered in the medical school, law school, and biological sciences program. This will soon expand to include the School of Public Health, journalism, and pharmacy. Embedded counselors offer more tailored outreach and therapy specific to the needs of students in that program. Plus, students can access care without ever leaving the academic services building. The Multicultural Health Program centers the experiences of Black, Asian, Indigenous, and Latinx students, offering therapy, outreach, and liaison relationships. CAPS provides crisis intervention for students on campus and consults on mental health issues as needed. They also provide outreach in the community, supporting peer mental health organizations and mental health workshops. CAPS wants students to have access to the mental health supports that help them thrive. They listen to students to understand what they're needing and adjust services to best meet the needs of students on campus. But we need your help. You have the power to engage your student in conversation about what they know, what they've seen, and what they're thinking. You have more influence than you might think. College students overall are very receptive to ideas from trusted family members. They want to please you. They do not want to hurt you. Remind your student that you are there to help and always available to talk. It is likely that your student will encounter mental health and well-being issues on campus, and they might be confused about where to turn for help. Remember, the intention at UNC is that every person connected with campus, including everyone watching this video, has information that can be of assistance. So let's talk a little bit more about campus health. Campus Health is an institutional member of the American College Health Association and is accredited by the Joint Commission, which is the same accreditation agency used by top hospitals, including UNC Health. During the summer, Campus Health is open Monday through Friday from 8 a.m. to 5 p.m. They are closed on the weekend. During the academic year, Campus Health adds an hour of service on the weekdays and is open on Saturdays for same-day or urgent care needs. The Campus Health phone number that you see here is answered 24/7 by health professionals and can connect with campus health providers on call. Visits are available by appointment, which can be made by phone or online, as well as same-day care without an appointment for those urgent needs that just can't wait. Campus Health provides comprehensive health services, including both on-site and telehealth. As you can see, Campus Health goes well beyond primary care, addressing many areas, including sports medicine, gynecology, an international travel clinic, and dental services. We want to draw your attention to our pharmacy services because we have comprehensive pharmacy services in 2 on-campus pharmacies. Student stores pharmacies, like we talked about, on the top floor of student stores on main campus, and the Campus Health Pharmacy, which is located in the basement of the Campus Health building. Both are full-service pharmacies and provide both over-the-counter and prescription medications, including controlled substances like ADHD medications. New this year is that pharmacists can provide oral contraceptive pills under a state medical director prescription, so students can access contraception without needing a visit to a provider. There are also 2 vending machines stocked on campus by the pharmacies that offer after-hours access to health supportive items. Flu shots and COVID vaccinations are provided, no appointment necessary. It's very easy to transfer your or your students' prescriptions. Just call or stop by the pharmacy of your choice. Both pharmacies also offer free and confidential naloxone distribution. Simply request a kit and you and your student can receive one, no questions asked, to keep on hand in case of overdose emergencies. We do sometimes get questions from incoming families about how to have their students' refrigerated medications delivered to the residence halls. The details for how to arrange for special handling are available on the UNC Housing website. As you're likely aware, immunizations are required for students who are joining the Carolina community. A list of the required vaccines that each student needs to submit is located on the immunization form, or they can also be found on the Campus Health website. The general deadline to submit documentation of immunizations is June 15th. If students are unable to complete the immunization requirements during the summer, they will be able to receive all required immunizations at Campus Health when they arrive in the fall. Please note that per North Carolina state law, if records are not received 30 days after classes begin, the student will be withdrawn from the university. Nobody wants that to happen. So here's what you do. The link to the immunization form is located on the student's Connect Carolina Student Services page under the General Items to-do list. After the form is printed and completed, a medical provider can either sign the immunization page to verify the immunization dates, or the student can attach a copy of verified immunizations, meaning they've been signed, stamped, or otherwise made official. All documents will need to be uploaded to the Connect Carolina to-do list item. Campus Health cannot accept mailed or faxed records. If after reviewing records, additional vaccines are required, a new to-do list item will be added to the student's Connect Carolina Student Center page. On the topic of confidentiality, if a student is over 18, that student must give permission to share their health records. For students who are under 18, parents or guardians will be contacted about treatment, with the exception of those medical encounters indicated on the slide. Campus Health does not accept blanket authorizations, meaning a student needs to request records be shared for each encounter. The student's emergency contact will be notified if a student is in a medical emergency and unable to communicate. If you desire to be that point of contact, please make sure your student has put you as an emergency contact in Connect Carolina. Let's dive into insurance for a few minutes. Health insurance is required for all students attending schools within the UNC system. Students need to either waive out of student health insurance using proof of creditable coverage, or enroll into student health insurance each semester. If your student waives, there is a checkbox option for that insurance information they provide to be used to meet the waiver requirement for the entire year. Then your student will get an email confirmation each semester that the waiver was approved. The deadline to waive in the fall is September 10th, and in the spring is January 31st. For folks who are interested in enrolling in the plan, here's a brief overview. It's administered by Blue Cross Blue Shield of North Carolina. The plan's deductible is $0 for any services at Campus Health and $500 for other in-network facilities. After the deductible is met, the plan pays 20% of in-network charges with a $4,000 maximum out-of-pocket charge. We encourage those students who are interested in enrolling in the Student Blue plan to do so before August, as the plan begins on August 1st. This slide shows the health insurance plans that are in network at Campus Health. The Campus Health website has specific details about in-network plans, and that URL is listed on the slide. You should know that Campus Health is in network with over 90% of students' health insurance plans, but for those not listed, visits to Campus Health will be billed as out of network. Campus Health is actively trying to remove barriers for students accessing healthcare while they're at UNC Chapel Hill. Please remind your student about Campus Health services available to them and that there's often no additional cost for care. Here's all the contact info for the entities, as well as our social media handle for Facebook, Instagram, and Twitter. The Carolina Blue buttons on this slide give websites for the to-do items for your student this summer, the immunization submission and waiving out or enrolling into student health insurance. We encourage you to take a photo or screenshot of this slide and to save these websites, phone numbers, and our social media handle to return back to when questions arise. For those of you who have questions that I did not answer during this presentation, the main page of the Campus Health website has family frequently asked questions listed on the front page of the website. You can also search any of these websites for information you may be looking for, or access the peer listeners from the Heals Care Network or CAPS websites. Please reach out if you have questions or concerns about your student. We are all within this community of care together, and we're so grateful for your support.